Yesterday was my first day in the urogynecology clinic, and that inspired me to want to discuss a very interesting disease. Let's talk about interstitial cystitis. Let's review a little bit of anatomy. So we have our kidneys here, and remember, our kidneys are what filters our blood. Blood is constantly flowing through the kidneys, and as it's flowing through, the kidneys are extracting different electrolytes and fluids, and it's putting them into the ureters. The ureters will then drain down into the bladder. The bladder will then slowly fill with urine, and what it'll do is it'll actually tend to expand at a relatively constant pressure. This expansion stimulates nerves that respond to stretch, and what will happen is these nerves will actually signal to the brain saying that the bladder is full, and then the brain will then signal back to the bladder later on when it's appropriate to void, and you can consciously go to the bathroom. This urine-holding structure, the bladder, is what becomes inflamed in interstitial cystitis. Interstitial cystitis is a bladder pain syndrome, and it affects about 100,000 women in the United States. Interstitial cystitis is relatively rare and can affect both men and women, but it just affects women more often. Interstitial cystitis is exactly what it's named. It's a nonspecific inflammation of the bladder. These patients tend to have unpleasant sensations or pain in their bladder area. They also might have difficulty urinating or pain with urination. Symptoms also tend to get worse as the bladder fills up. Now, what's really frustrating for patients is we don't exactly know what causes interstitial cystitis, and therefore we don't have great treatments for it. One theory or idea that scientists have is that this is an autoimmune reaction. In other words, our body's own immune cells are attacking the bladder and causing it to become inflamed. Here we can see a bladder that was cut in half, and this is the inside of the bladder, and here we see a mucosal ulceration caused by interstitial cystitis. This is supported by the fact that under the microscope we can see inflammatory cells, especially mast cells, gathering right in the bladder wall. So what we see here is a sample of bladder wall under the microscope. This here is all bladder wall, and this is the inside where the urine would go. Here we can see the innermost layer, which is the epithelium. This is a special type of epithelium called urothelium that can stretch really easily. Below this dark purple layer, in the subepithelial region, we see a ton of different tiny purple dots. Most of those are immune cells that aren't supposed to be there. Another theory is that IC can be caused by loss of glycosaminoglycans, or GAGs. These are mucopolysaccharides with water-repellent properties that can coat the inside of the bladder wall. They can help protect the urothelium from toxic agents within the urine. There's actually other theories, but that's all we have time for. Thanks for watching.